This is Andrew Kramer, Urology Associates, Cape Cod, and this gentleman is courageous. He's younger than I am, victim of prostate cancer, has some ED, actually has some leakage as well, but just showing up for surgery was a struggle for him, as it would be for anyone. And we're going to deliver him a great result to be proud of. But the action starts right away. The catheter will not pass. Now, he's had prostate cancer. He must have a little bladder neck contraction to a degree, but urologists that do implants are also urologists, so I was able to get the catheter in. Thankfully, I got a 14 French in, but he has some leakage and he's got a little bit of a stricture. Thankfully, the catheter went in. We can deal with that at a later date. The priority now is get through Buck's fascia and show the corpora beneath. You see me pulling up and pulling down, stretching that little scrotal space there. When you stretch linearly, there's the catheter under the finger. To the side of it is the tunica, and there. I take my scissor, I make a window in what's called Buck's fascia because I want to get to the pearly white, stripped down Buck's fascia. When I get in there, that's the erectile chamber, and taking down the septum on the bottom also springs forward the tunica there, as you see left and right. Otherwise, you're up high on the shaft of the penis, up way too distally. When you take that septum like that, I can use my scissor there, swim through the dartos as I showed you, and get down to Buck's fascia low on the penis, low on the shaft to maximize external penile length. So holding stitches now, once I've got that tunica, the pearly white tunica, stripped bare, white, clean, no more Buck's fascia, I'm happy I can make my incision in the corpora. So we've already struggled a little cleaning off Buck's, taking down the septum, even the catheter was a struggle. We're going to dilate up and down. And we do. We go down. He's a sort of a thin, narrow guy, so it's not very far down. And we get good measurements there, but he's got scar tissue. Corporal fibrosis, I'm going to need the scissors. In his case, I choose to use a scissor with the tips closed. Just a little bit open on the way down, but I don't go up sharply with the scissor open. I go up tips closed and spread when they're up. Ultimately, I get through the corporal fibrosis, get to the tip, and on that side, that was the harder side. The left, not as bad for whatever reason. The blue dilator is enough for me to get to the tip of the penis and all the way down on the left. So he's got a little bit of pathology there, and reservoir goes in. Now he's thin and muscular, but nonetheless, I can get that reservoir in deep, concealed. Had to go through a little bit of muscle, a little bit of scar to the prostatectomy, but no problem in that case. That was the easiest issue of all. Now the cylinders go in, and thankfully, I get a measurement. I get 18 and no rear tip extenders. I'm going to give him all cylinder, no rear tip. Someone else might have given him a 16 plus 2 or even less, but I stretch, push the envelope. I come up with 18. I'm going to put the cylinder in, and you see, they look a little bulgy, like maybe it's too big, but you got to push the envelope. I'm not going to settle for being comfortable with my cylinders being in. I'm going to push and stretch, and you're going to see in the end how good it looks. So I'm going to close the corpora now. I opened it, now I'm closing it, and I use a stitch here to tuck in that cylinder. Like I said, it looked like it's bulging out. Is it too big? No, it's not. It's going to fit because you got to account for the penis being on full stretch. And when you stretch it out, that is going to sort of slither all the way down and all the way up. So it looks like it's a little bulgy when you're not pumped up. When I pump it up, it elongates and stretches, and you're going to see it's going to fit him perfectly. I trust my measurements, and I trust my pushing the envelope, and I trust the 18 that I measured is going to be the right size, even though the cylinder looks a little aggressively sized. When I pump it up, which I'll do now, I like the result. Tubings look good because the pump's got to be all the way down. Otherwise, it's not going to be happy. You got to address everything. You got to have the perfect reservoir. You got to have the perfect cylinders. You got to have the perfect pump. So I'm going to do a triple splice there on the pump. That's a technique because the tubing, I use an infrapubic kit scrotally, if that makes sense, to make sure I had the right amount of tubing length, and I do. Pumping it up, great result. I think that penis is really solid, straight, and we got rid of that sort of Coke bottling or hourglassing Peronis. We got rid of the curve. We gave him a straight, stretched out penis, all length and girth he had. Pump goes low, deep, independent, and then I'm going to close in multiple layers. Give him a really good result. Tiny little scratch in the scrotum with dissolvable stitches. Catheter out tomorrow, and prostatectomy is not going to affect him anymore as far as sexual function. Andrew Kramer, Urology Associates, Cape Cod. Thank you so much.